I'm reviewing my patient's chart for allergies and code status. I'm going to wash my hands and put my gloves on. Hello, my name is Makai. I'm going to be your student nurse today. Can you tell me your name and date of birth?
My name is Brandon Michael Pike. I was born January 21st, 1998.
Okay, and today I'm just going to be doing a physical assessment. It's not going to cause you any pain. It's going to be real quick. I'm going to provide privacy, so I'm pulling our curtain back. I'm going to gather my vital signs from the vital sign machine. And we have a 22-year-old male. Can you tell me your height and weight?
I'm 5'9" and 183 pounds.
Do you have any allergies?
I have no allergies.
Are you in any pain?
I'm in no pain.
Okay, so you have good posture, good grooming habits, and now we're going to move on to your head assessment. So can you tell me what day of the week it is?
It is Wednesday.
And where are you?
I'm in the hospital.
And why are you here?
I'm here to get a physical assessment, routine physical assessment.
So I'm just going to examine your head, and I'm looking for any bumps or lesions, and I'm also looking at your hair. It's thick and clean. I don't see any bumps or anything out of place. And just looking, can you raise your eyebrows up, and can you smile and smile with teeth and frown? Okay, so you have very equal measurements of your face, and so your eyebrows and eyelashes are very well distributed and symmetrical. So now we're going to move on to our eye assessment. We're going to move on to our eye assessment, and I'm looking at the sclera. It's white. I don't see any redness. And so now I'm going to be shining a light in your eyes. Okay, your pupils are 4 millimeters and reactive to light. Okay, so I want you to look past this object. Okay, and it's going to come closer and you can look at it now. Okay, good. All right, and so now I'm going to assess your nose. So I'm going to be looking inside your nose. I'm not seeing any lesions or edema, no discharge. Can you hold one nostril shut and breathe out? Okay, and do the same with the other. Okay, good. So I'm going to be looking at your lips. They are moist, they're not dry, they're pink, I don't see any lesions. Can you open your mouth? Okay, so I see all your teeth intact. I don't see any cavities, anything missing or chipped. Do you wear any dentures or partial dentures?
No dentures.
Can you stick your tongue out at me? Okay, so tongue is pink. And open your mouth one more time. So soft and hard palate are intact. All right, I'm going to be looking at your ears. Okay, I don't see any discharge or lesions. Look at your other ear. Okay, I don't see anything, lesions in that ear. All right. Okay, and I'm going to be looking at your trachea to make sure it's midline, and it is. And I'm going to be looking at your thorax to make sure you have equal chest rise and an equal breathing rate, and you have a good rhythm, which you do. So we're going to be moving on to our cardiopulmonary assessment. Going to be listening to each location for about 10 to 20 seconds. Okay, so we're going to be looking at the aortic, the pulmonic, and the Erb's point, tricuspid, and mitral valve. Okay, so I'm going to be listening to your lung sounds. There's going to listen to 6 points on your front, 2 on each side, and 8 points on the back. So just take a deep breath with each point that I listen to.
All right.
can sit up. Okay, good job. So your breath sounds are equal and clear, and I heard S1, S2 at every heart location. I didn't hear any murmurs or anything out of place. I'm going to be palpating your anterior and posterior thorax. Okay, I'm not feeling any masses. Are you having any tenderness?
No, ma'am.
Okay, so take a deep breath in and out. Good job. Okay, and can you scoot forward just a little? Okay, so I'm palpating back here for masses. Are you having any tenderness?
No, ma'am.
Okay, take a deep breath in. Good job. I'm going to be assessing the peripheral pulses. So this is going to be my carotid pulse, and just lean into my hand. Okay, and lean into my hand again. Okay, so now we're going to be doing the brachial pulse. Okay, and they're both equal. Going to be doing the radial pulse. Okay, and they're both equal. Then I would be feeling the femoral pulse. So I'm going to lift your blanket. So I'm going to be feeling the occipital pulse. Can you bring your legs forward just a little? Okay, and then I'm going to be feeling the posterior tibial pulse. And then I'm going to take your shoes off. And right now I'm going to be feeling the pedal pulse. And that completes my pulse assessment. Okay, I'm going to be assessing your hands and feet. So lay your hands flat. And I'm checking for temperature, quick return of color. I'm also going to be checking for skin turgor, right, and capillary refill. Okay, I'm going to be doing the same on your feet. So checking for temperature, quick return of color. Okay, good skin turgor, and quick capillary refill. And that completes my assessment of your hands and feet. Okay, now I'm going to be doing your abdominal assessment. So I'm looking at the stomach. I'm not seeing any masses, any abnormal movement. So I'm going to be listening to all 4 quadrants. Okay, and I hear active vowel sounds in all 4 quadrants. So I'm just going to be feeling. Do you have any tenderness?
No, ma'am.
Okay, so I don't feel any masses. All right, and so I'm also going to be palpating the bladder for distension. And I'm not feeling any distension. So that completes your abdominal assessment. So now I would be doing the perineal assessment. I would assess your groin for lesions, discharge, skin breakdown. I'd also be inspecting the rectum for lesions, discharge, skin breakdown, or any protrusions. So throughout our assessment up to this point, I've been assessing your skin throughout, and you have no bruising, no skin breakdown, and no lesions. You have good return of color, so no concerns there. I'm going to be looking at your fingernails and your toenails for texture and color. Okay, so now I'm going to be assessing toenails. Okay. So now I'm going to be assessing your muscles. So I'm going to be looking at your arms and your hands and your feet, looking for any deformities. I'm not seeing any. So can you lean forward now? I'm going to be palpating and looking at the spine for any deformities. Not feeling any. Okay, so now I want you to push against my hand. Good. Okay, and push against my hand. Good. And squeeze my hands. Okay, so I'm going to put my hands under your feet. You're going to push down like you're pushing on the gas pedal. And pull up like you're pulling your toes towards your nose. Good. So you have equal strength on all extremities. And now we're going to move on to our range of motion. So now I'm going to be assessing your range of motion of your upper limbs. So we're going to start with your neck. You're going to go up and down. Good. And then side to side. Good. So now we're going to check your shoulders. So bring your arms out. Okay. And this way. We're going to do a full circle. Good. Okay, so now I'm going to check your wrists. So take your wrists and pull your hands up and down. Okay, so make a fist. All right, so now we're going to take your fingers, put your fingers up as far as they go. Okay, flip your hands. We're going to touch our thumb to each finger. Okay, so you have good range of motion of all your upper extremities, and we're going to move on to your lower extremities. So now we're going to be assessing your lower limbs for range of motion. Starting with your spine, lean over, touch your toes, okay, and come back up. Now we're going to be assessing your hip. So take your knee up, out, make some circles, go to the side, and stop. All right, we're going to do the same with the other leg. So up, out, circles, side, and back. Now we're going to assess your knees. So go up and out. Okay, and up and out. So now we're going to move on to your feet. So press down like you're pressing on a gas pedal. Go up like you're pulling something. Turn towards the inside, turn towards the outside. Okay, other foot. So down like a gas pedal, up to the inside and to the outside. All right, so you have full range of motion of your lower extremities, and that completes your range of motion assessment. Okay, so now I'm going to be assessing your gait. So if you can walk towards this wall and walk back. Okay, perfect. You have good gait and you don't need any assistive devices. Okay, so that completes your physical assessment. I'm going to remove my gloves and wash my hands. I'm going to leave you in a safe and comfortable position. Your call bell's right here if you need anything. And now I'm going to go document.